I'm very pleased to introduce our first speaker, who's a trusted colleague, practitioner, scientist, and teacher here at the Lurie Cancer Center, Dr. Tim Pearman. Dr. Pearman is a clinical psychologist at the Cancer Center. He serves as the director of our supportive oncology program. He's also a professor in the departments of medical social sciences and psychiatry and behavioral sciences here at the university's Feinberg School of Medicine. As I mentioned, Dr. Pearman is a provider at the Lurie Cancer Center, and he brings his expert perspective in working with patients that are managing a cancer diagnosis. Tonight, Dr. Pearman is going to be discussing the impact of the 2020 pandemic experience on top of dealing with a cancer diagnosis, treatment, and survivorship. I'm very pleased to welcome Dr. Pearman.
Thank you so much, Diane. It's good to see everybody. This is a great group. So thank everybody for sharing your time with us tonight as well. Yeah, so just wanted to talk a little bit tonight about this crazy year and a half that everybody has had. I hope everybody can actually see the screen and hear me. Let me know if not. But I feel like this question keeps popping up for me and for the people that I see in the Cancer Center. Like, isn't cancer just enough? I mean, how can we possibly be expected to deal with all the COVID-related things, the political unrest of the past year, and cope with all that? And so tonight, I just want to try to spend a few minutes providing a little bit of a framework for understanding and talking about some of the difficult emotions and thoughts that everybody has when you're managing cancer, and on top of that, managing a global pandemic, and talk just a little bit about some techniques that hopefully can help with that. So to start, complicated feelings that come along with the diagnosis of cancer, like anger, guilt, uncertainty, obviously those are really common, but these feelings also are compounded by things like the global pandemic, but we often don't talk about them enough. And so I hear a lot of times people say things like, you know, I have it really easy compared to other people that I know in my life, and I shouldn't be feeling this anger or this uncertainty or this worry. So I think it's really important that we just acknowledge that we all are experiencing those things. And if I were giving this talk in person tonight, I would ask the audience who has heard someone in their lives say this: think positive. You just have to stay positive. And I would guess that every single person in the audience would raise their hand and say that they have heard this from someone in their lives at some point during their cancer journey. And what I would say about that is, I think it is important to try to stay as healthy as we can, to try to think as positively as we can. But it is also psychologically healthy to have those positive feelings, those feelings of gratitude and happiness, alongside feelings like guilt and anger and fear and all of those things. So it doesn't mean that you're not a positive thinker if you have some of these negative thoughts over time. So how do we typically cope as humans? Well, most of us tend to adopt sort of a problem-solving approach. And in general, that's very adaptive. We focus on sort of identifying the cause of the problem that we have and focusing on reducing or eliminating the source of that distress. But this strategy is most effective when the stressors are controllable, obviously. So in the time of COVID, obviously, a lot of these stressors have not been controllable. And when you're diagnosed with cancer, it can sometimes feel like there's almost nothing in your control. So the problem-solving approach doesn't always work. And so I think it's important to just talk about what we can do differently if we can't utilize this problem-solving approach. And a lot of what that involves is sort of finding things that we actually can feel some control over. So these can be things like physical activity, our diet, stress reduction, taking control of our medical care and our medical decisions. So I'll talk just for a minute or two about each one of these things. These are the American Cancer Society guidelines on physical activity. And so they're pretty broad, they're pretty general. I think physical activity is probably the number one most important thing that you can do after being diagnosed with cancer to maintain your health and your well-being. But one of the questions that I get asked a lot is, what kind of exercise should I do? Like, what's recommended? And as you can see from these guidelines, they are pretty broad. They're not really specific. And so what I tell people in general is that if you go to PubMed, as I'm sure everyone on this call has done, if you go to PubMed and type in exercise and cancer, you will get published research articles from all over the board that have looked at the things that you would expect, like moderate intensity walking, yoga, but you'll also find things that have looked at kickboxing, Zumba classes, working out at home with a Wii Fit device, and almost to a study, they've all been found to be helpful. So what I tell people is, if you have something that you have found helpful in the past in terms of exercise, go back to that. As long as you get the sign off from your doctors and your medical team, it's fine to do almost any form of physical activity that you can. Nutrition is another thing that we can establish some control over. And again, these are the American Cancer Society guidelines for nutrition. And again, I think they're a little bit broad and general. So for instance, this second bullet point says limit the amount of processed meat and red meat that we eat in our diet. My wife, Jenny, who is a vegetarian, will joke with me that we can go down for a weekend to see my very Southern family, and we can go an entire weekend without having one meal that does not involve bacon or red meat. And so if you come from a family like mine, limiting the amounts of processed meat might mean, I'm going to have red meat twice today instead of 3 times today or 4 times today. And that's obviously not the intent of the guideline. And so I say that just to point out that I think for all of us, it can be really important to utilize the resources that are at hand in the Cancer Center. Ask to meet with a dietitian or somebody that can actually talk about your specific diet if this is something that's a concern for you, because none of us can be expected to be the experts in this. And it's really important to get some expert opinions on this. And if you're a patient at Northwestern, you certainly have access to the full range of supportive care. Stress reduction is another kind of bullet point that I think we can all exhibit some control over. And I will say that stress reduction, I think, varies person to person. It may mean finding some positive distractions from your cancer treatment or the rigors of your cancer journey. It can mean engaging in some activities that make you laugh. It can involve writing in a journal or doing some relaxation techniques like meditation, guided imagery. And also, the one thing I would like to really point out is it's okay to ask for help. And I think that's a really difficult thing for a lot of people. If you're used to being the caretaker of your family and you have to care for your kids and your spouse and maybe elderly parents, it can be really hard to ask for help with that. But I really want to encourage everybody to just consider that that's okay if you need to ask for a little bit of help through this journey. The other thing is, this concept of mindfulness, I think, is something that has become sort of a buzzword in our culture. And I think it's not always clear, what does that mean to be mindful? This is John Kabat-Zinn, who's kind of the godfather of mindfulness and has done a lot of really good research in this area. This is his definition, and I like that. But I actually kind of find this graphic a little bit more helpful for me. In that, I'm reminded of this every day, honestly, when I walk my dog, and she is really interested in, wow, this puddle of pee that's right here is totally engaging to me, and I'm really interested in this. Whereas I'm thinking about, like, let's get this walk over. I need to think about, like, what I'm going to do at work today, what's on my list of things to do, and so forth. And so it's really easy to get distracted. And so the concept of mindfulness really relates to being still and focusing on the moment that we are in. And so a lot of this, if you see a therapist, I'm a psychologist, so if you meet with me, a lot of the things that we talk about is, attention to breathing, doing some mindfulness exercises that involve deep breathing, which is called diaphragmatic breathing, doing a scan of your body and trying to realize when we might have, our muscles getting tight in our shoulders or something like that, where, you may get a headache because you don't realize how tense your body is. And then trying to do things to sort of counteract that, noticing your thoughts and your feelings, not judging those feelings. So if you're having negative thoughts, if you're worried about the future, if you're worried about your next scan, viewing those thoughts as, okay, that's fine. The way I like to think of it is we should view our thoughts and our feelings almost like a cloud in the sky. So if you're looking up at the sky, you can sort of see this cloud pass over the sun. And for a moment, you think, okay, that's bugging me. Like, it's no longer sunny. Now it's cloudy. But you know that that cloud is going to move past the sun, and eventually the sun's going to come back out. So viewing those thoughts and feelings without judgment is a big part of mindfulness. So just in summary, I think it's really important for all of us to just honor and to understand that a diagnosis of cancer and what all of us have been going through with just the state of the world over the past year leads to some complicated feelings. And it's important for all of us to just sort of give ourselves a break, to cultivate some compassion for ourselves, to realize that we're not always going to feel positive, and to accept that and ask for help with that when we need to do so. It can also be really important when you're diagnosed with cancer to identify some values and strengths that we have to create meaning in our lives. I've had a lot of people say to me, I wouldn't wish cancer on my worst enemy, but it has absolutely provided me with a moment where I could create meaning in my life, where I realized I was spending way too much time worrying about things that weren't that important, worrying about how much time I was spending at work, and not spending enough time with my family or doing things that are really, really important to me as a person. So this can be an opportunity to sort of reevaluate the things in our life that maybe weren't making us happy before our diagnosis. And again, being mindful, connecting to the present moment, these are all things that we can really cultivate in ourselves and can be a process. And reaching out for more help, please do not hesitate to ask your medical care providers to know more about what supportive services are available in the cancer center where you receive help. I've included this slide just because I think everybody is going to have access to all the slide deck after this. So these are some really wonderful resources that you can pull up that talk about how to cope with a diagnosis of cancer, how as a family member or a caregiver you can approach this, and how you can move through the cancer journey and into the period of survivorship. So I will stop there, and I would be happy to answer any questions that anyone has.
Hi, Dr. Pearman. I have a few questions for you. This is Diane. For a patient said, how do I know if I'm tired or fatigued from treatment versus actually getting depressed?
That's a great question. What I will say is those often coexist. So it's not necessarily one or the other. I think, again, as I said earlier, I think if there is one most important thing that you can do after a diagnosis of cancer, it's to make sure that you are continuing to exercise, continuing to move. And again, it doesn't matter what kind of exercise you do, but if you find that is not improving your fatigue, your mood, it can be really an indicator of depression. And so then it's important to ask for some help with that, to see a counselor, or it can also be important to ask to meet with a physical therapist, or to go to a rehabilitation center, depending on your symptoms. But I think the most important thing that you can do is just raise this issue with your treatment providers. Because a lot of times I think when we're diagnosed with cancer, we tend to think, I want my doctors and my nurses to focus on curing my cancer. So I can handle the fatigue, I can handle the pain, I can handle the depression. I just want them to be laser focused on curing my cancer. But it's really important to know that you can ask for help with this, and there is help available to you.
I have another question from one of our attendees. This is related to just accepting, the mood and living in the mood of the moment. And this person says, how can I can accept not always being positive considering my situation, but how do I get my family on board? I feel like they're always looking to see if I'm happy or sad, and I let them down if I'm not, in a happy mood.
Yes, that's, again, great question. One of my mentors, whose name is Jimmy Holland, and she was a psychiatrist at Memorial Sloan Kettering in New York City. She called this the tyranny of positive thinking. And her point in saying that is that when you're told constantly, like, you need to think positively, don't let yourself get depressed, stay positive, that can lead to a lot of guilt. And we can feel like, not only am I burdening my family if I'm feeling depressed or I'm feeling anxious, am I also impacting my cancer? Like, is my cancer more likely to recur or progress if I'm not feeling positive, if I do have some depressive symptoms? And she felt like, the reason she called it the tyranny is that she felt like it is completely unrealistic to think that you could be diagnosed with a potentially life-threatening illness and be positive all the time. That just is not realistic to do. So I would say the first thing is to just communicate that to your family, that this is a really normal part of cancer survivorship and moving through cancer. And if they aren't able to hear that, then I think there are options. You can talk to your care team, ask to see a therapist or a counselor, and maybe get some of your family members involved in your care as well.
I wonder, Dr. Pearman, if you could just go over a little bit about the supportive services that we have at Lurie so that the patients or the attendees can have a path if they feel like they want to reach out and get a little bit more support.
Of course. Yeah, we're actually really lucky at Northwestern and Lurie that we have a full range of services. So we have psychologists, social workers, dietitians, medical educators, patient navigators, a great fertility preservation program. So you have access as a patient at Northwestern and Lurie to all of these services, and you can be referred to any of those services through your doctors, your nurses. You can self-refer. So when you're coming to clinic and checking in and out, you can ask to meet with a psychologist, a dietitian, or whatever you feel like you need. So we've tried to really open the doors wide in terms of the access that people have to our services at Lurie. And also, we provide those services within the 3 clinical cancer centers downtown, and also in our regional centers, we have access to those services as well.
I think that's where we are in terms of questions. I think we're about at time too, Dr. Pearman. So unless you have some closing thoughts, I just want to thank you for presenting today and for kicking off our virtual Cancer Connections program. And have a good evening. Thanks for joining us.
Thanks so much, everyone.